children with autism are not receiving early intervention before the age of 3. So what we want to develop is tools that can bring children earlier to intervention. And we know that earlier intervention means better outcomes for children and their family. It makes a huge difference in terms of language, in terms of independence, in terms of behavioral problems, and even just the stress and anxiety of the family. The idea behind our project was to develop a system, a smart system that can advance universal screening and really take advantage of the routine developmental checkups that are anyhow occurring in the community, and can really be the first, the first step in realizing that a child needs more thorough evaluation. So we were thinking of how we could build a smart system that's based on machine learning and population-based data in order to take a child's electronic record till that point at where the child is in age and time, and estimate the child's likelihood of autism based on these machine learning tools. Our research included about 780,000 electronic health records of children born 2014, 2019, because we wanted at least 2 years of record data for the child. And we identified among these children about 1,100 children with an ASD diagnosis after the age of 2 years. So it was very important for us that our measurements that go into our machine learning model are up to 2 years, and the diagnosis is after 2 years. The children's data, as I said before, included about 100 features. So these were familial features like maternal age, birth parameters like pregnancy week, birth weight, postnatal factors like anemia and nursing information, and growth parameters and developmental milestones. So we see there's a mixture of motor, social, language milestones that are among the top 20 features that are associated with elevated autism risk. Now, what's interesting is when we look at prematurity, because we know premature babies are more delayed in their developmental progress, that does not account for these differences. So these differences are not due to whether the child is prematurely born or not, but their combination is associated with the elevated risk of autism. We're really excited by the potential of our model to make a change in how we are using data that already exists for a child and can be actually harnessed to estimate their autism likelihood. Now, the interesting thing was that it was not only developmental milestones and not only parent concerns, but it was really a mixture of features that the model used in order to predict autism. It was birth parameters, it was familial information, developmental milestones for social communication and fine motor domains. It was growth measurements and postnatal factors. So it was really a mixture of information that the providers record throughout the visits of this child and family. There's also technology advances that we could bring into the surveillance program that, today there's a big debate about ChatGPT and whether it's good or bad for us, and we're going to see it coming into play in many domains. I think in healthcare, one of the things that machine learning and artificial intelligence can help the providers focus their observations, not replace a more thorough evaluation of autism, but to make a decision support system that is based on a machine learning approach that could look at population-based data, estimate the child's risk level, and prompt the provider to ask one two more questions in order to verify that status and refer for more thorough evaluation. And I think we shouldn't fear from ChatGPT, but think how we can harness that together with population data in order to advance the services, the community services that we can provide to families as early as possible. We're talking about under the age of 2 years.